Have you ever felt a strange fullness in your belly? Or heavier periods that seem to get worse as you get older? Maybe your lower back aches, or you find yourself rushing to the bathroom more often. You might think it's just part of getting older. But what if there's another reason? Today we're talking about a condition that affects up to 80% of women before age 50. Yet, most of us know very little about it. It's called uterine fibroids, non-cancerous growths that can appear in or on your uterus, especially during the years leading up to menopause. In this video, we'll explore what fibroids are and why they develop, how they behave during perimenopause and menopause, what symptoms to look out for, the best treatments, from medical options to natural lifestyle support, and finally, how to take control of your body during this often overlooked stage of life. Because understanding fibroids isn't just about your uterus. It's about your comfort, your confidence, and your overall well-being. Fibroids are non-cancerous tumors made of smooth muscle and connective tissue. They can grow inside the uterine wall, on the surface, or even hang from the uterus by a stalk, like a small mushroom. Some fibroids are tiny, smaller than a seed. Others can grow large enough to make a woman look several months pregnant. Most women will develop fibroids at some point, but not everyone has symptoms, so why do they form? Doctors believe hormones like estrogen and progesterone play a major role. These hormones, which help the uterus prepare for pregnancy, also stimulate fibroid growth. That's why fibroids tend to grow most during your reproductive years, and often shrink once menopause begins, when estrogen levels naturally drop. However, not every woman's experience is the same. Some fibroids can continue to grow even after menopause, especially if the body produces extra estrogen from fat cells or adrenal glands. Other risk factors include being in your 30s or 40s, a family history of fibroids, having obesity or low vitamin D levels, eating a lot of red meat and few fruits or vegetables. And interestingly, Black women are 2 to 3 times more likely to develop fibroids, often at younger ages, and with more severe symptoms. Understanding these triggers is the first step toward managing them and taking back control of your body. Perimenopause, the time leading up to menopause, can feel like a hormonal roller coaster. Your estrogen levels rise and fall unpredictably, and your body starts to react in new ways. During this time, fibroids often appear or get worse. In fact, around 30% of new fibroid diagnoses happen during perimenopause. You might notice heavier or longer periods, pelvic pain or pressure, frequent urination, or that familiar feeling of bloating or fullness in your belly. Fibroids can also intensify perimenopausal symptoms, worsening fatigue, cramps, and mood swings. But here's the good news. As you move closer to menopause, when estrogen levels start to fall, fibroids often shrink naturally. Still, this transition can be tough. Many women mistake fibroid symptoms for normal perimenopausal changes, or they delay seeking help because they think, "This is just what happens at my age." If that sounds familiar, don't ignore your body's signals. Heavy bleeding, pelvic pain, or any unusual changes deserve a conversation with your doctor. After menopause, usually around age 51, your ovaries stop producing estrogen and progesterone. In most cases, that means fibroids shrink and symptoms improve. But there are exceptions. Some fibroids may continue to grow, especially if your body produces small amounts of estrogen from fat tissue, or if you're using hormone replacement therapy, HRT. So, can fibroids grow after menopause? Yes, but it's rare. When they do, symptoms are usually milder, like light bloating or pelvic pressure. If you ever experience bleeding after menopause, That's something to take seriously. It might be related to fibroids, but it could also signal another condition, so it's important to see your doctor. Even in menopause, regular pelvic exams and ultrasounds can help monitor any growths and keep you safe. If your fibroids aren't causing problems, your doctor may recommend watchful waiting, keeping an eye on them over time. But if symptoms are affecting your quality of life, there are several effective options. Medical treatments include pain relievers like ibuprofen or naproxen for cramps, hormonal birth control to regulate bleeding hormone therapies such as GnRH agonists, which temporarily lower estrogen and shrink fibroids, tranexamic acid, which helps with heavy bleeding during your period, or iron supplements to prevent anemia from blood loss. If medication doesn't help, there are surgical options too. Myomectomy, removing the fibroids while preserving your uterus. Uterine fibroid embolization, blocking blood flow to fibroids so they shrink. Radiofrequency ablation, using heat to destroy small fibroids. Or hysterectomy, removing the uterus entirely, which eliminates fibroids for good. Each option depends on your age, symptoms, and future pregnancy plans. That's why open communication with your healthcare provider is key. There's no proven and natural cure for fibroids, but certain lifestyle habits can make a real difference. Try to eat a balanced diet, rich in vegetables, fruits, and whole grains. Limit red meat and processed foods. Avoid alcohol and caffeine if they worsen your symptoms. Exercise regularly. Even light walking can help balance hormones and reduce stress through yoga, breathing exercises, or meditation. Some research suggests that vitamin D may protect against fibroids, so spending a few minutes in the sun or taking a supplement could be beneficial. Remember, small daily habits can create big changes in how you feel. Fibroids can be uncomfortable, even frightening, but they're incredibly common and rarely dangerous. Understanding how they relate to menopause can help you make informed, confident decisions about your health. You don't have to just live with it. There are treatments, options, and support available. And it starts with knowledge. If you found this video helpful, don't forget to subscribe for more insights on healthy aging, menopause, and women's health. Because the more you know about your body, the better you can care for it at every age.